One of the biggest challenges in NMC OSCE is performing clinical skills correctly under pressure. But don't worry, in this video, I'm going to be sharing with you proven strategies to help you stay calm and perform better even under pressure. Mastering your clinical skills so that you can perform with confidence and accuracy. Without further ado, let's dive into it. The first strategy is get to know those stations that you are likely to be examined on. NMC OSCE tests varieties of OSCE stations such as wound assessment and dressing, administration of medications, administration of intramuscular injection or subcutaneous injection, among others. What you need to do here is, the first solution is, you need to make a list of those skill stations and practice as much as you can. You cannot over practice, colleagues. Yes, you cannot overdo it. Make a list of it and practice it regularly. The second thing you need to do is, you need to watch OSCE videos. When you see the correct techniques being demonstrated, it helps you to retain it better. The third thing you need to do is, your marking criteria should be your guide, nothing more and nothing less. Anything that is not written in your marking criteria might not be important. If you see it in the marking criteria, it does mean it is so important that you must not leave it out. The second strategy is, you need to follow step-by-step process. Every skills have a structured approach. When you skip this approach, it can result to you losing marks. What you need to do is, you need to use a checklist for each skill. That is, you should break it down into clear steps. Second thing you need to do is, you need to practice loudly. That is, you verbalize those things you are doing loudly. This helps information to get retained better. Remember the why behind each station. It is important not to just memorize, but you need to understand, because it is when you understand that you will know rationale behind your action. Third strategy is, you need to prioritize infection control and patient safety. Many candidates fail not because they don't know the skills, but because of common mistakes such as forgetting hand hygiene and improper patient ID checks. What you need to do about this is, always sanitize your hand before and after each procedure. Most essentially, leaving your patient's bedside and coming back to your patient. The second thing to do is appropriate use of your PPEs. Wear gloves, apron, goggle, or mask where necessary. Ensure patient comfort and dignity. Introduce yourself. Explain the procedure, that is, the reason why you're visiting the patient, and obtain consent. The fourth strategy is, you need to practice under exam condition. Practicing scenarios in the comfort of your home, if you are not simulating examination condition, it's not the same thing as what you are going to be faced with on the exam day. So it is better you subject yourself to such pressure now while you're still practicing and get used to it. The first solution to that is, you need to time yourself whenever you're performing skill. Get used to working within stipulated time. This is key. You need to get used to it. You may struggle at first, but trust me, you will get used to it. The second solution to that is, you need to ask for feedback, constructive criticism from family or a trainer. This will make you to be better and improve on those areas where necessary. The fifth strategy is, You need to stay calm and professional during your exam. Nervousness can lead to mistakes, but staying calm can help you to perform better. The first solution to this mistake is, whenever you make a mistake, correct it anytime you remember. That's what the leverage OSCE gives to candidates. Whenever you remember it, verbalize it to assessor. If it were to be real clinical settings, I would have done this, or I forgot to do this. That will make assessor to know that you actually know what you are doing. As failure to communicate it, you will be marked down, because it is assumed that if it is not communicated, the examiner will not assume on your behalf. The second solution is, you need to maintain good body language and tone of conversation at all times, showing confidence in your actions. The third solution is you need to speak to the patients throughout the procedure, carrying them along. Let them be part of the care you're rendering to them. Finally, on that note, mastering clinical skills takes proper and adequate practices. But with the right approach, you will perform better on your examination day. Now that you've learned how to perfect your clinical skills, I will see you in my next video on how to pass the OSCE API stations. Until then, keep practicing OSCE. Bye.